Thank you so much for joining us. We're going to get started in just 1 minute. We really appreciate you joining us today on infectious disease planning for your business. We've got some great experts and some great tools and resources we want to share with you. I am Nora O'Brien. I am the CEO of Connect Consulting Services, and we're really excited to have you join us today. We know that this is a very topic that is top of mind for many of us dealing with the COVID, for everyone across the world dealing with COVID-19. Again, I'm Nora O'Brien from Connect Consulting Services. This is infectious disease planning for your business. We want to give you some tools so you understand how we communicate with us. We have here, let's see here. If you're not really familiar with GoToWebinar, here's some information. How to ask a question. So if you have a question during the presentation, it doesn't look like we have any questions as of now, but if you have a question, just click on the question button and you can put that question in. We will be taking questions near the end of the webinar, but if I or one of the other speakers that are joining us today say something that sparks a question or a comment, if you could put that in the question box and we'll get to you at the end. Okay. The other thing that we get questions about all the time, because we do regular webinars, frequently asked questions is, can I get the slides? We get that a lot, and so that's a lot of people. That's usually one of the first questions people put in the question box. So we're just trying to, save your fingers, get some from typing. So yes, the slides are going to be sent out after the webinar. And the other question we always get is, can we get the recording? Well, a couple of good things if you haven't taken one of the Connect Consulting Services webinars and joined us. You can view the recording at our YouTube channel. The hot link on that slide is right to our YouTube channel. Feel free to subscribe to our YouTube channel as well and our other webinars we've taken before. But please join us. We're always looking for more subscribers. Share our subscribe link with your colleagues. And our goal is to provide you as much resources and content as we can. So, okay, getting into the agenda for today. We're going to be talking about, I want to talk a little bit about the WHO pandemic phases and as it relates to COVID-19. And we can't really talk about infectious disease without talking about COVID-19, so we're going to get into it straight away. But then you get to hear from my colleague, Linda Mead, to talk about the keys to infectious disease planning and give you some resources and process. In addition, Eric Engel, our training and exercise specialist, is going to give you best practices about infectious disease in healthcare agencies. I'm going to be talking a little bit about for your business, specific to businesses, and again, questions and comments, and then offers and resources that we have available. Okay. So today, this is us. You want to say hi, Linda, and talk a little bit about the work that you do? Linda Mead?
Yeah, thanks, Nora. I was on mute. Good afternoon to everybody. Again, my name is Linda Mead, and I've been working in the healthcare ecosystem between public health and primary healthcare for 20 plus years. So I've kind of been on both sides of the work. I'm currently working as a consultant, working with networks, but also doing some project management around health information technology. So it's great to be with you today.
Thank you so much for joining us, Linda. I'm Nora O'Brien. I am the CEO of Connect Consulting. I have master's degrees in public affairs with disaster and emergency management background. I've been working in healthcare emergency management for my entire career for the last 18 years. Certified emergency manager, also past chair of the IAEM Healthcare Caucus and FEMA instructor, and then also led H1N1 pandemic response efforts, also wildfires and hurricanes. So both done practitioner work, but also assistant as well. So Eric, you want to introduce yourself and talk a little bit about the work you do?
Yes, good morning. My name is Eric Engel. I've been in the field of emergency services now nearly 30 years, started out as an EMT, became a registered nurse, and I've been an ER nurse for nearly 20 years. I've been a specialist in emergency management for the last 15. I'm also the chair of the local and regional emergency management committees for my local counties as well as the Valley County areas. And also I've been an instructor at the Center for Domestic Preparedness in Anniston, Alabama, and co-author of 2 books on emergency management.
Yeah, so you're in good stead here, folks. So thanks so much for joining us. Moving on here. I want to now talk a little bit about the WHO pandemic phases. And where when you think about infectious disease, you're like, okay, making sure that the infection stays away from me and my, me and my employees and my family, et cetera. But we a lot of people are not aware of, we're all experiencing the whole issue of COVID-19 and how much it's spread. It is so widespread, but there's actually some peaks to it, and there's actually some phases. So this might help you as you're developing your infectious disease plans, because it's not just about what you do now, but what you do into the future in dealing with this infectious disease. We're also going to be talking specifically about COVID, but we're also going to be talking about there's other types of infectious disease. So it depends on the type of event or the different type of, whether it's Ebola or influenza or whatever it may be. But in terms of a pandemic, we're going to be talking about that. So we could easily say we're in phase 5 or 6 where we are today, is that, phase 4 was probably early January, where it was sustained human-human transmission, but it hadn't gone widespread and was contained in the, within the country of China. Now that it's literally in every country across the world, we're in that widespread human-human transmission. And when we have that infection across the world, we still don't know what the whole intent of what we're trying to do right now is, as many of you have all heard incessantly, is flattening the curve. Flattening the curve. The whole point is what we want to avoid is having where the cases go down you get to the post-peak phase. The cases go down, but then it spikes again because kind of people go back to their normal lives, so to speak, in air quotes. And then we see us, increase in cases again because our social distancing measures were not effective, or people want to go back to their lives. So it's going to be quite a while before we get to that post-peak and post-pandemic phase. The reason is that until we have a vaccine, which, last I heard there was over 115 different agencies and companies working around the world to develop the vaccine. So it's not for the lack of trying, but it's just going to take a while to get it to the, past the clinical stage and actually be able to be effective. But it's probably you're going to need to plan for at least a year before we have human-to-human transmission that is reduced as a result from a vaccine. So we're not going to be in the post-pandemic transition for quite a while. Kind of knowing that there's an arc to these kinds of infectious disease outbreaks maybe helps you to think about how it's going to impact your business, how it's going to impact your organization, how it's going to impact your community and yourselves and your family. So sharing with that pandemic phase hopefully will allow you to kind of figure out where how you can move forward. Okay, so again, I'm going to talk about the social distancing orders. I mean, there have been stay-at-home orders literally in every state of the nation and across the world. The one map that I like to go to, just because I want to get an idea of kind of what the update is, and because it's a real-time tracking, the Johns Hopkins case count tracking map. You can go to that hot link. It's kind of sobering information, but it also is information that's necessary to kind of know where the peak is and what, how it might impact communities. We know that the COVID-19 is having a significant impact on your lives, your business, your loved ones. But we do know that the longer you stay home, the shorter time we all need to stay home. And it's a tough situation that we're in. But when you have these kinds of infectious diseases that, you know, that's a novel virus nobody has immunity to, it's going to be, you know, it's going to take a while until we have immunity, whether everybody gets it and so we're immune, and or we have a vaccine. So that's going to be go for quite a while. So I'm going to now give it over to Linda to kind of talk about infectious disease, kind of the tools for planning for infectious disease.
Great, thanks, Nora. I'm going to cover just a few things that that are relevant and important for you as a business, as a manager of people or a manager of things or manager of services, are really important to keep in mind when doing your planning and training. It's hard to kind of set yourself aside from what is currently happening now, but really look at this as a moment for you to test some of your systems, to make refinements, to do some situational adaptations to what we're doing. So really key to all of what our goal is to achieve proficiency. And that's, again, usually in our world, it's around proficiency of staff and the ability for staff to do their jobs. And to really be successful or as successful as the situation allows. So there's 3 areas to consider in success in maintaining that proficiency. And one is around documentation, one is around training, and then the ability to sustain and keep sharp on some of the skills and knowledge and information that you need to use to move forward. So I'm going to cover each one of these. So the first I'm going to talk about is documentation. You guys, so really in healthcare world, and this may vary a little bit in different types of businesses depending on what discipline you're in and what governing entity that you answer to or have to be licensed by or certified, whatever your area of discipline is. They all require some kind of adaptation. So really, we really look at what are policies, and that is really the governing type stuff. A lot of folks, this is a policy would be approved by a board or else follows legal requirements of policy. So those are things that don't change a lot, but in situations, especially situations like this, you really need to stay on top of those because those are, again, your legal documents. And they should be reviewed on an annual basis or on a basis where situational change has happened. The other area, and again, this is one that would be fast moving right now, is on some of the procedures. And this is what the implementation phase of a policy looks like. You can be a lot more nimble around procedures and processes. You can be nimble in the development and the documentation. You just need to be able to have ways to communicate that information. So it really is, what are the steps needed to perform those activities or tasks? And then something that staff would have quick reference to that isn't full of a lot of legal jargon, but really quite simple and to the point. We might use a little bit more graphics or table for a quick glance. I'm going to share an example of that a little bit later. And this doesn't need to go through, in some organizations, a very formal process. So it doesn't need to be approved by a board of directors or some other kind of legal entity. And again, they're to be reviewed and changed, and probably a lot of fast moving changes right now, but I would encourage you not to go overboard and change all of your policies and procedures based on this single event, but take your lessons learned, and down the road or when things slow down off that curve that Nora just shared with you, take some time to update that information, again, situationally, for what you need to make changes and do a better job, a more proficient job next time. And then the last area is really around guidelines. And this is the best practices or standards of operation. I know a lot of folks deal with SOPs in the work that they do, but this is another way to capture and review and get some of those little lessons learned, and also get some of the institutional memory preserved so that you have that information for a little bit farther down the road. So keep that in mind as you're developing written documents and actually going through the process to review. And the key, really one of the keys is to make all of these three areas align and serve as a tool for leadership so they can stand unified behind all of those three categories of documentation and support. So the next area that I'll address briefly is talking about training, education, and skill building, including maintenance of those aspects of a person's job. Really, really critical is to build onboarding or build all of this information into an onboarding structure. And that could be something before you start a position. It could include requirements or training or education or certifications. You can make some assumptions if people come in with certain degrees or certain licenses that they have skills and knowledge and have proven proficiency. It still is the employer's job to question that and keep those things sharp. So there's the work before you actually start the position, and then there's the on-the-job training. One thing that I find when I'm working with a lot of clients is that there's not a really tight onboarding plan for folks. You might sit down and talk about how you do your timesheet or how do you use your key fob to get in and what's your email and stuff like that. But really there should be a series of tiered on-the-job onboarding that you do that would include training, and for some areas they really need to also be checked on some of the skills and education that would be required. I think you need to do your due diligence when you're working with folks and make them part of your team. And then of course the continuous stuff. So this would be based on any changes. So as I mentioned a little bit earlier, and you're going to hear I think from Eric, that some of these situations are pretty fluid and there really needs to be ongoing real-time changes. And then some things are just slower to changes or improvements or new equipment or new training outlines and stuff like that. But really your goal here is to continuously train your staff, keep them sharp, keep them informed. And I don't know anybody that doesn't appreciate having their own skills and knowledge increased at through their employer. I think it's actually a very nice feature for employers to have that. So document stuff, have checklists, all of the stuff that you would need to track who's doing continuous learning. And then the next area is really about sustaining. So what are you going to do to sustain and keep your response team together? And again, this could be happening real time during an event like we're in now, but when things settle down in the next 6 months or a year, I think this is the time to keep your team together and debrief on this. If you're in emergency management, there's always several different ways that you can debrief on a situation. If you're a business where you're not in the healthcare business, but you're actually in some other kind of line of work, it's still a good idea to take the administrative view of what happened and what did you do well as a leadership team and as your response team. And then again, part of what it is what did we do well? Where could we have done better? And what will we do differently next time? And don't forget to ask the people that were frontline responders to this. In my company that I work for, we're having at least monthly meetings with our senior leadership, and they're telling us a little bit about what they're doing, and they want our feedback. They want to know what's working for us and what isn't, and then again put that into play for the next time around, because there will be a next time around. So the plan for sustaining and institutionalizing those standards, and there will be a new normal after this, like a lot of major disasters or major events, there will be a new normal, and we need to make sure that we capture that and make adaptations as needed. And the last slide that I'm going to share with you is just an example of how you might take some of those policies and procedures, put them into a quick glance reference around either a guideline or this could be procedures. This is an example put together by OSHA. This actually is about a 30-page document that kind of gets down to the heart of what they're trying to say is on this single slide. So they're defining the occupational risks in this situation, and then they've identified levels, and then they have different descriptions of what type of people would be involved in that kind of a risk level, and then what are some of the protection examples. And they have 3 types of controls: engineering, administrative, and personal protective equipment for this particular document. So when you're looking at a big document like that, not many people want to sit down and read it. So as managers or as somebody that's responsible for this type of a response, this is a great way to display at a glance what's in a more robust document. So I'd encourage you to think this way as you're putting together some of your support documents for your event. And Nora, that's it for my set.
Sure. I just want to talk about one thing that you want to talk about this table before we move on?
Sure, I can add to this. So in some work that I did with Nora with some of her pandemic planning toolkit that she has. Again, this is a quick glance way to put together and kind of a brain trust of folks to talk about who should we be talking to, how are we going to monitor the situation, and what are we going to do during an active situation and during an inactive period, and how are we going to surveil those partners. And many of you have probably heard others say, and Nora says this, you don't want to exchange business cards during a disaster. I think this is that same type of concept, is you don't want to have to meet your local health department medical director during some kind of a pandemic. You want to have some kind of relationship. I think Eric's going to talk a little bit about the healthcare coalitions. That's a good example. But even if you're in business that isn't directly tied to the provision of healthcare services, but maybe some other kind of supplemental support or another business that you're trying to consider, this should be filled out where you should look at who are my key local, regional, state, national, and international folks that are credible and reliable sources and credible and reliable partners. Some of these people may or may not have resources, but these are the people that are in the know. Right now, these are the folks that are part of emergency operations centers. And this can be adapted, again, for your organization, but I would encourage you to consider putting together this at a glance, and this should be reviewed at least annually, if not more, because people change, positions change, there's resources that come and go. So I would encourage some kind of a quick glance document like this where you're tracking the information that can be shared across your agency.
Okay. Thank you very much, Linda. We really appreciate it. Now we're moving on to Eric. Eric's going to talk about hospital and healthcare infectious disease best practices. So infectious control and sort of what they've done and how some of these might be modeled in your organization. Eric.
All right, so we're going to talk about some things that we've learned even from previous and our response to a current pandemic. Some challenges that hospitals are facing currently. We're decreasing the number of beds that we have, going from double occupancy rooms to single occupancy. It's happening everywhere. So we're reducing the amount of care areas that we can provide care for patients, including our critical care units and ICU units. They're decreasing while the population, especially our vulnerable populations, are actually very much increasing in the need for these rooms. And many hospitals have converted to the just-in-time inventory practice. It's a cost-saving measure. It's been working, but in some sort of pandemic where we have not only a local, regional, but global problems with obtaining key supplies like personal protective equipment, this could absolutely hamstring hospital or healthcare agencies' response.
Okay. Next slide. Okay.
Next slide, yes. And of course, we have seen a rise in the increase of public on EMS transportation and emergency departments as our primary medical care physician. There's been a lot of folks that have been saying the primary doctor is the ED. And it is one of those big problems that is out there currently. When we have issues like the pandemic and people need screening process or swabbing, the ED isn't the place to go for that. You need to reach out to your primary first. And that's a big problem that we've been seeing across the country. Lack of support for emergency preparedness, drills and exercises and planning. The virus of apathy has kicked in, so to speak, in many agencies that something will never happen here. Well, I'm sorry, it is happening here. It's happening everywhere. It is important to be able to plan, to train, to develop those policies and protocols and those guidelines for when it does happen. And we have to plan ahead for absenteeism, especially in a pandemic incident. Staff increased absenteeism can be up to 40% or more. Depending on the incident, it could be even higher. We have to think they could be sick, but their family members could be sick. So they need to have some education ahead of time on what to do when that occurs. And we need to plan for multiple waves of the pandemic. Nora talked about the various pandemic phases. Plan of the various kinds of response that you may have in those phases and what those phases could do to the facility where you work. And we have to plan for the unknown. There's going to be more that we don't know than more than we know during the initial response. Case in point, when this first broke out, at my facility alone, we had a 300% increase in use of personal protective equipment. We went through over a month's worth of masks, isolation gowns, and PAPR, power air purifying respirator hoods, in less than 4 days. Why? The unknown factor. There was a lot of miscommunication on various kinds of personal protective equipment needed. Plan ahead. Know that you need to have extra equipment in store just in case something like that happens. Next slide.
Okay. Getting there. Okay.
All right, so even before the pandemic occurs, get a team together, sit down with them. That team should be consisting not only of personnel from your facility and your agency itself, but team members from your community, from your emergency medical services agency, your local healthcare coalition members, your public health departments, your fire departments, your EMS. Get a team together and help work on protocols for surge, and definitely work on pandemic response protocols, and consider the use of incident command. There's lots of tools that are out there for the hospital incident command system that can be easily converted to a healthcare incident command system for whatever agency you work at. And those tools that are out there, they're free for pandemic planning and response. You have the incident response guides as well as the incident planning guides that can help take you through step by step on keys that you may need for developing your protocol. And have that relationship with those community members well ahead of time. You don't want to have to give a phone call to somebody that you've never talked to when you need their response. And evaluate your hospital capacity, your patient throughput, your surge capacity. Think what rooms and areas you can use ahead of time for putting patients in. Think about how you can double up patient rooms that went from single occupancy, put them back up to double occupancy. Think about placements of any sort of surge capacity or alternate care site tents that may need to be outside your area. If alternate care sites are considered, because we are in the electronic age, make sure those care sites are factored in and mapped in for whatever sort of electronic health records or electronic management tool that you utilize. And make sure any key exterior locations have Wi-Fi capability. Very, very important. We're very lucky that when we planned ahead here at my facility, we actually mapped out our external sites for our surge capacity tents, which we have been using since the 5th of March to deal with the corona outbreak. We actually made sure that we had Wi-Fi nodes mounted in the exterior locations so we can use our workstations on wheels for our EHR, electronic health records, and any sort of communication needs that we may have out there. Next slide. And again, plan ahead. Think honestly what sort of personal protective equipment, consumable equipment that you may need, especially related to PPE, N95 masks. Utilize the ones that you fit test to. Don't utilize some N95 masks that you can't really use in your facility. PAPR hoods, if you use PAPR, power air purifying respirators. Make sure you have a cache of those hoods. Isolation gowns as well. Face shields that can help protect the mucous membranes as well as protect the N95 mask that you're using. Perhaps goggles as well. 5 to 8 weeks is what's recommended in pandemic planning. If you can do this, I highly recommend doing this. The Joint Commission standard of 96 hours for a pandemic isn't going to get you very far with PPE. And it is a requirement to have orders of succession and delegation of authorities planned and set in place. Who's going to be in charge of what when this happens? And we have to consider that. Maybe your chief nurse executive or a CEO gets sick, gets ill, or worse. Who's going to take over for that individual? Have this all planned out in your continuity of business operations well ahead of time, and have this very much in place and ready to roll out.
Yep.
Next.
Okay.
All right, so now we're actually in the pandemic. In the early phase, every day evaluate the amount of personal protective equipment that you're going through, not only in your in-house capacity, but your stockpiles. Monitor this, look at the burn rate, and see what you're using the most of. This way you can figure out what you need to use, start ordering early from your internal vendors, start ordering early possibly from, if you're part of a healthcare system, from their logistics and their command staff to get more equipment to you. And then potentially you could start looking at reaching out to your local healthcare coalition, your local health department for their caches that they have maybe in their stockpiles, whether it's local stockpiles of equipment or even now the strategic national stockpiles worth of equipment. And it's very important to monitor the information that's coming in. You needed good vetted intelligence. That's information that is accurate. We are kind of battling that now with so much information that is out there and so much that is just being presented as factual that is honestly not factual. So we need to really rein that in, because if we don't, this is going to have a lot of fear that can build up into your staff that can cause absenteeism, overuse of PPE, or even more. Activate your incident command and your surge plans early. It's better to activate early than too late. That way, when and if a patient surge does occur, you'll have that patient flow, that staffing flow, all those kinks have been worked out. We were very successful in activating our surge plans early, and we have a very adept patient flow process in place here. I always recommend getting that done and in place early, because everything is going to be changing potentially on a daily basis. This is going to be a fluid situation with the pandemic, because information changes on how we need to respond, sometimes even from the CDC with information on personal protective equipment, on things that we need for droplet or any sort of isolation precautions we need. So have this, and if you have this set in place when those changes occur, it can easily be adapted to your process. Next. And of course, staffing is critical. We need to plan ahead, have good family preparation ahead of time. Give your staff information they need on personal and family preparedness so they can prepare it in their homes. Encourage finding family support for childcare. Potentially encourage staff members to work out together for childcare for each other during different shifts. Also consider if they can do any sort of duties from home. Can they actually work from a home computer or a home system? If they can, plan ahead on the tools that they need to do this. And also cross-training, cross-train other departments. If you have an outpatient surgical department that's going to be closed down because of this, maybe cross-train them to provide care in-house to your inpatients. If you want to set up a step-down isolation unit that's a step-down ICU, cross-train staff members to work in there. And you could also potentially cross-train folks that can handle ventilators. If you use some sort of surge ventilators, maybe people that can monitor that and can be cross-trained by super users from your respiratory therapy department. Also, we can't forget the mental health. on the staff. This is going to be huge, and I know we've seen this, the fear that's out there, the loss that's out there. We have a lot of folks that are feeling that firsthand. With this, you know, make sure that if you have any sort of critical incident stress management or psychological first aid folks that are out there, maybe chaplains, maybe set something up that they could do debriefings every day, maybe messages that can be sent out every day of encouragement, just anything that can help with this, because these are scary times. And we have to consider the ethical aspects of this as well. This is something that we may have to make choices that we never thought we'd have to make. If there's a critical ventilator shortage and we have two different patients, one that may survive, one that will for sure survive with a ventilator, they may have to make that choice to pull a ventilator off one patient and put to another. These are decisions that can stick with us. These are things that can impact our mental health. We have to consider that. And we have to figure out ahead of time how we will manage this. Next slide. And communications. And these are those vetted communications, accurate communications. Designate maybe one source that this comes from. If you have a communications department internally, or if you have a designated public information officer, have this information come from them. Don't blast lots of messages out. Just one good message that comes out. Could be a message not only on daily changes, situational updates that can help keep staff in the loop. It could also be messages out there on what they can do every day for their mental health, what they can do for their physical health, things that can help quell this fear and panic. Briefings are very important too. A morning briefing and an afternoon briefing. This includes your leadership team. This includes your incident command staff. Key discussions in this are any sort of changes in response, problems that have been presented from the responders that are out there, the first responders, the teams that are taking care of the patients, as well as your PPE burn rates, things that we can look at ahead of time in real time to know, hey, in a week, we're going to need this many masks. And knowing what we need so we can request it from the stockpiles early is very, very important. Also, plan ahead for when demobilization occurs, when you're going to potentially take your tents down. What triggers are you going to use to demobilize your incident command staff, demobilize your staff that is working from home? What are you going to do? What are your trigger points going to be to help do this? And how would we manage those? And after the fact, review the processes that you had in place. This way, potentially when a second wave occurs, and you start re-upping your response, everything will be in place. You'll have it planned out. You'll have it ready to go. This way, you don't have to start again and reinvent the wheel. And you could use it in the second wave. You can use it in a pandemic response 10 years from now. But don't forget the lessons that you learned. Put these in guidelines, put these in policies, and put these in your after action reports. One of the things that we've been doing that is very successful, any patient that we bring through our surge capacity tent, that the next day we actually do follow-up phone calls to see what it was that they experienced, if they had any recommendations, if they had any problems with their visit here. And not only is that patient satisfaction, but that gives us a different view, not only from our staff that are responding, but from the patient's aspect too. So that's very, very important. We learned some great lessons from that as well. Next slide.
Great. Wonderful.
And I think that's it for me.
That's it. So Eric, I really appreciate, and Linda as well, what you guys have been able to share for now. I'm going to talk a little bit about preparing for places for COVID-19. This particular slide is, well, it's a header slide, but also has a lot of resources from OSHA, and that's the hot link at the bottom there, at the bottom right. We're going to talk about some strategies, give you some strategies, and also share some resources soon. Okay. I'm not sure if you all have seen this particular hot link, and this is also a page at the bottom right as well. So CDC has now put together an interim guidance for businesses and employers to plan for and respond to COVID-19. So as both Linda and Eric have said, this is a fast-moving event. There's new information that's always being shared about, transmission, about, what it means in terms of who highest risk groups, et cetera. So what we highly recommend is you bookmark this particular coronavirus section because you'll probably be going back to this page as new information comes out, and this is specific to businesses. So it's not specific to every single business, but there'll be some great resources that you can add to your own toolkit as you figure out what your response process is, and more importantly, down the road, what your recovery is. So highly recommend this particular resource we wanted to share with you. And what I liked about it is it's a one-stop shop for guidance. And again, while it's called Interim, is because this is a fast-moving event. New information becomes a light, again, on transmission rates and who is the highest risk groups. And initially was just only seniors, and now we've seen people of all ages, unfortunately, perish from COVID-19. So, just when we expect that we understand how this works and how it transmits, et cetera, new information comes to light. So it's important to use this information to move forward. We do want to say that as much as we all want to get back to work, and we've talked about, we are going to have another surge, as we've talked about earlier. We are going to have another surge. Before we actually have a vaccine, because while we certainly love to be able to stay in our homes and do everything in our jammies and Zoom calls, that's not every single person. Some people, if you're a healthcare worker, and frontline healthcare worker, you can't work from home. You obviously have to be on those front lines. But there are some best return to work planning, but it's something you can do now to plan for when people are coming back to work, when essentially the country is reopened. One thing that I didn't mention, but I do want, it just also comes to mind, is that the whole issue, so I was during H1N1, obviously it was a very different event. It was a lot milder, even though it did have 1.6 million cases of people that were impacted by H1N1, including me. We did have 274,000 deaths over that whole year that we dealt with H1N1. One thing that was different about that experience versus today is that testing, essentially, everyone were calling for there were shortage of test kits in 2009 during H1N1, and that became a real problem because people wanted to know, so they know how to treat it, et cetera. Was it the seasonal flu? Was it just, was it H1N1? And the clinical guidelines were a little bit different for the different types of events, versus seasonal flu versus H1N1, which was an influenza virus. So test kits, essentially, what ended up happening is test kits were super important in the beginning, but as it became more widespread, and as a pandemic does, when it becomes widespread human-human transmission, test kits were not as important because they just kind of assume that you have it, and they're just based on that assumption giving you the treatment for H1N1, and hopefully that you get better and you don't perish. So that was one experience that we had in 2009. During this event of COVID, what test kits are far more important than they were in the past. The reason is because it's more deadly, because it's more highly transmissible, and there's so many more cases. Testing should be part of your testing and temperatures, temperature testing, but also testing for COVID, either the antibodies, which usually someone's had it, and also, or they've actually recovered. Testing should be part of your return to work planning. So we're not recommending you test every employee, but it's something for you to think about. It's you should actually put it in your toolbox. And our kind of going back to what Linda said is developing a relationship with your local health department, knowing who that person is, knowing who to call, and finding out what they recommend about as people start to return to work. And we're right now in essential services. you know, and as more things come online over the next few months, you know, many governors, we're based in California, many governors are taking the same tack of, we need a lot more testing to make sure that people have either had it, you know, they've been asymptomatic and they've recovered from it, but that testing piece is really key. But it's something to think about, whether it's just, it's a point, it's not required, but it's just definitely a best practice for you to think about whether you want to test your employees or offer testing, or if you can find testing. So I know also the availability is testing, that's a whole nother ball of wax. So for those of you who have already wrote questions about like, hey, we don't have, we're concerned about that. So developing, but what's important is to do before things people go back to work, is develop and train your staff on infectious disease, your internal process for infectious disease policies and procedures. Very much talked about what kind of building on both what Linda and Eric said. It's just important having those procedures. If you don't have them, now's the time to develop them. Do you have, you know, do you have a process for identifying people? Let's say they're feeling feverish. Do you have a process for your supervisors and managers to identify those individuals that become ill, what to do and what that policy is? And it's going to look different for every workplace, but you know, maybe it's going to be just more work from home or whatever that may be. But figuring out what that process is now, if you don't have it worked out, is critical. And then training those staff on your staff on what those procedures are. We work with clients all the time and develop those procedures, help you develop those procedures. If you need our help, let us know. But the other thing is plan on a regular extreme cleaning. If people are going to be in the same, you know, saying again, until we have a vaccine because it's highly transmissible, plan on a regular extreme cleaning. And you're like, okay, that's overkill. Really, it may not, you know, but you just never quite know that where your actions might. And people might be uncomfortable going back to work if you're not doing that regular cleaning on a regular basis. Do know that once people are come back to work, physical distancing will still be the norm until we have a vaccine, in which we, again, don't think that's going to be for at least a year. And maybe it's sooner than that. And I mean, God love them, we'd certainly love to see that. But, you know, I'm listening to the experts, and the experts tell us that it's going to probably be a year. So that physical distancing until the vaccine is available, place your desks more than 6 feet apart. You also might want to have a best practice of alternating staff returning to work. So maybe, you know, if your last name starts, you know, A through N, you know, you work in the office on Tuesdays and Wednesdays or whatever, you know, half the people work from home, half the people in the workplace, if that's a possibility. And then limit in-person interaction as much as possible. We certainly love to sit around a conference room and have a conversation, but we've all learned through this whole event that it's how much we can do remotely and actually still be effective. So these are just some best practices. This is not an exhaustive list, but these are some things for you to think about. But having a return to work policy and plan will help you be more effective and keep your employees, their families, and people you interact with safer. So that's key. We wanted to let you know too that we have a pandemic response planning guide that we've developed. It's based on the WHO pandemic planning phases. For each phase of the pandemic, we give you some business continuity tips and tools, resources. There's also ways, resources to manage the incident response. Also, we talk about business continuity planning considerations. We also talk about mental health, because I know each of us, I know Linda and Eric touched on it, that mental health piece is just as important as that physical health. And the mental health, not dealing with the mental health stress and anxiety that an infectious disease event like COVID brings. It's just an important way to do that and identify some resources. So it's a direct download from our website. It's $250. You get an hour of consulting. You know, we just bumped that up to 2 hours. So certainly love to have you see if that's a good fit for you, and as a way to get an idea of what to do next. As you know, too, many of you have come to many of our webinars before. We have finally completed the CMS Emergency Preparedness Toolkit. We're putting the final touches on it right now. It is, it's the compliance, everything you need to be compliant with the CMS rule, but also it has a whole section on pandemic planning, infectious disease response, which is a requirement for CMS. It's got updated training and tools and exercise resources and a provider reference chart for all the changes and reflects the new changes from the omnibus burden reduction. So that's going to be available. So we'll send out some information about that. This is what we do and who we are, Connect Consulting. You know, pandemic response planning recovery is obviously a really popular request from our clients, but also we do emergency operations planning, business continuity planning, training, you know, workplace violence. We're actually seeing an increase in workplace violence. I'm sorry to say, especially in healthcare agencies, you know, how to de-escalate. This is, again, high stress, high anxiety of individuals and are dealing with things that, you know, it's probably on their worst day they never expected. So how to de-escalate. So we do those kinds of trainings as well. Conference speaking, that's probably not going to happen for quite a while, probably till next year. But we also do keynotes and but also webinars, et cetera. So if you need a speaker, let us know. And you know, if we have webinars once a month. So, but if you want to just have some one-on-one time and see how we might be able to help you, you can book a call directly from that link. We also register for our monthly webinars and our newsletter. See what questions we may have. Okay. You guys, let's see, question here. Where can we get the templates for policies and procedures? I'm not sure. We have the templates for policies and procedures. I think that was probably let's see, maybe what Linda was talking about. What we do have is in our CMS Emergency Preparedness Compliance requirements Toolkit, we do have sample policies and procedures for shelter in place, evacuation, patient transfer, patient tracking, emergency supplies, those things that are required. There's 10 required policies. It depends on your provider type. So we have those kinds of templates, and that's included in our toolkit. Is there any other questions people may have? You can
Nora, I would add to that comment about policies and procedures, and those are pretty discipline specific. So I think, you know, what Eric covered in a hospital would look different than what it might look like in a federally qualified health center, but there is some commonality that runs throughout those. And the one thing that I think is challenging administratively for stuff is the different kinds of plans that are in place. So to have like a risk management committee that does some stuff and then emergency management that does others, there should be occasional meetings across all those teams that are doing planning and risk and stuff like that, probably at least quarterly meetings that everybody meets to align whatever efforts are similar, so that if you pull a handbook up or pull up a plan, that there's some continuity between those. So NORA has great stuff. There's other organizations that might have others, including trade associations or just associations. And then in healthcare world, if you're in a federally qualified health center, there's certainly some stuff available from ECRI and other sources. Just be sure to watch the dates. Just don't go back farther than some of these big rules, like this omnibus burden reduction or the omnibus HIPAA. Just be super sensitive to the ages of some of the resources you're looking at.
That's a good point. Thank you very much, Linda. This is a question that actually but I think Eric and I can touch on. When specifically thinking about an emergency preparedness plan, would it be best to keep it general, such as pandemic, and then create a separate policy for COVID specifically? Eric, do you want to touch on that?
I would keep a general pandemic plan, and then you could use that as your basis for the whatever sort of disease response that it is, because it is going to be fluid. I don't know if I design a specific per se COVID, but people are designing specific patient care plans, absolutely, because everything is a little bit different related to this, because, you know, with lung capacity and the damage that it's doing to body systems, it is unique for critical care. But usually we have a pandemic plan, we have a surge plan, and then you could develop tools from there based on the kind of response needs that you have. Because again, this is going to be very, very fluid.
And it's a really good question. I mean, I think the thing that I would also add to Eric's point of his answer is that what you should be doing, highly recommended, is a best practice, is to creating an incident action plan. And where your incident action plan is, what are the tactical things that you're going to do? What are the issues specific to your business, whether you're healthcare or a school or anywhere else? So like figuring out how COVID is specifically impacting your employees, your visitors, your whoever it is, clients, patients, or whoever, and then how you can best manage that incident with it. So we do all the time incident action planning with organizations all the time and help them develop an incident action plan to figure out all the tactical things and who's responsible, and also identify roles and responsibilities within your organization. Who's going to best be able to help you manage that incident as efficiently and effectively as possible. See if there's any other questions.
And potentially you could do that ahead of time too with the incident action planning guides for infectious disease. You could do a basic incident action plan quick start, have that all set, and then if something happens, you could look at that as your backbone and say, hey, we need to adapt it because it is this kind of infectious disease versus a standard type of flu outbreak. So absolutely, develop an IAP ahead of time.
Great question. Thank you very much for that. Appreciate it. So we've got just a few minutes yet. If there are any other questions, maybe even a comment, we certainly have you let us type that in. And if not, we can wrap up. But we really appreciate you joining us today. This is also our contact information. We encourage you to send it, go to our website, or connect with us on LinkedIn or Facebook or Instagram, and also our YouTube channel. If there's things that you can do to find out how we can support your effort. But great questions. We really appreciate you joining us today. I'm just going to go ahead. I don't see any further questions. So thanks a lot. And if you have any questions, please book a call with us here. We'll be happy to answer whatever questions you may have. Thank you very much. Thank you everybody for joining us today. We really appreciate it. Thank you.
Thank you.
All right, bye.